This is a rare moment. A chance for Suman Chakrabarti to stop and catch his breath.
And sometimes the biggest thing is that you're on all the time. It's just, there's sometimes no time to rest in terms of resting your mind. On a personal level, it's been a tough year.
And the past couple of weeks have been some of the toughest.
So right now it's 2 that have emerged.
Chakrabarti is an infectious diseases physician in Mississauga, just west of Toronto, in one of the hardest hit regions in the country.
We have, 1,000 COVID cases, but when you actually see a person's face and you see their story, you hear them, you're able to comfort them and answer their questions.
And when it comes to answering complicated questions, it turns out Chakrabarti has a knack. The married father of 2 grew up in southwestern Ontario. As a teenager, he was hospitalized from a kidney disorder, which inspired his interest in medicine. But he also had a passion for teaching.
When I was in the first years of med school, I really enjoyed being with medical students and residents. So doing that, I kind of have always naturally gravitated towards teaching of some kind.
When COVID-19 arrived last year, anxious Canadians had a ton of questions. And Chakrabarti volunteered to help provide some answers.
Here to answer our latest pandemic questions is infectious diseases specialist Dr. Suman Chakrabarti.
He's since given countless media interviews and written articles, including this one, calling for action to address the high number of cases amongst his South Asian community. Chakrabarti and his colleagues are also working to translate public health advice.
There's so much stuff coming out on a daily basis, information, misinformation. And I think the big thing is to try to not come to conclusions right away. I think it's okay to look at information. When you don't know what's happening, you say so.
So all is not lost, and I do think that we can get this under control.
I always like to give positive messaging. Nobody likes you finger wagging. There are times where you have to tell people that this is what we need to do, but doing it in a positive way as opposed to insulting people, shaming people. I think with that in mind, you can really be effective at messaging, and I try that every day.
And he's not alone.
Jeff, we've all known each other for a long time.
A Zoom call with some of Chakrabarti's closest, oldest friends, whose names you might also recognize.
Yes.
Wow, Lisa.
There's the painting.
Classy.
You like beat us all for backgrounds.
Yeah,
completely.
That's an excellent background, Dr. Barrett.
She can't hear anything. There she can, yeah.
Yeah, are you making the rookie mistake of not turning your mute off?
No, I was trying to pretend I was muted. You wish I was.
Zane Chagla, Isaac Bogosh, and Lisa Barrett, infectious diseases physicians who go way back. They went to school and trained together.
Quite frankly, I think some of the best friends I've made have been through training, and you spend a lot of time together with people, so you get to know each other pretty well.
And over the past year, Canadians have also gotten to know them. These 4 friends have become unexpected celebrities, providing a continuous carousel of media interviews and volunteering to help talk Canadians through the pandemic.
We have to communicate with patients. We also have to communicate with the general public.
I think I got some very good advice about 5 years ago from one of my mentors, who said, you know what, if you're given the opportunity to share information with the public, do it often, do it well, because otherwise someone else is going to fill that void and you might not be as happy with the message.
And in this pandemic, there's been no shortage of misinformation.
It's wild watching an idea that's wrong or misinformed form online, and you can watch it amplify before your eyes and look at people comment and build off it and springboard on it. It is absolutely mind-boggling to see that happen. And you realize, what a task it is to combat that. And quite frankly, I think we failed.
Well, it's great to have you all here together. And of course, one thing you've all been doing to help combat that misinformation and confusion has been taking questions directly from the public, from Global News viewers. And unsurprisingly, a lot of those questions lately have been focused on vaccines.
Hi, I'm Stacy and I'm from Calgary. And my question is, I'm wondering what the presence of the new virus variant means for the efficacy of the vaccines.
Right. So we know those virus variants that were first discovered in the UK and South Africa are more contagious, but what about the vaccines? Dr. Barrett, will they still work?
Right now, the information from the labs that are studying these, it looks like the vaccines are going to be mostly effective. That could change over time. But right now, it's really important that people remember that the vaccine and getting it is going to be way more effective than not getting it at all.
Hi, my name is Elsa Holland. I live in Yoho, New Brunswick. I currently receive treatments for breast cancer. Has the vaccine been tested on people taking cancer treatments that suppress their immune systems?
And we've received a lot of questions like that from people who are immunocompromised, obese, or have pre-existing health conditions and are wondering if the vaccine will be safe for them. Dr. Chagla?
So these are done in clinical trials with relatively healthy people. There were people with, a small number with HIV, a small number with obesity, a small number with diabetes and high blood pressure that were incorporated into these studies. And, not enough to say that there's any big difference, but certainly there wasn't any difference that was seen in those responses amongst those individuals. Some of the other very complicated diseases like cancer, people on immune medications, people with autoimmune diseases were not incorporated into the clinical trials. Now, there's nothing in this vaccine that is suggestive of someone getting an adverse reaction in those groups.
My name is Massimo Kyoto, and I'm from Windsor, Ontario. My grandparents have been living alone during this pandemic, and my mom has type 1 diabetes. And I was wondering, how will elderly living in their own home or people with chronic conditions like type 1 diabetes be notified that they can receive the vaccine?
So over to you, Dr. Bogosh. As a member of Ontario's Vaccine Distribution Task Force, what do you think?
It's really dependent on supply. I can't state that enough. And the programs across the country are going to expand rapidly as supply increases. And certainly as these programs ramp up, there's going to be simultaneous public communication, just informing people who's eligible for the vaccine, how they can get it, where they can get it.
Okay, and we're now 10 months into this pandemic, and more than 500,000 Canadians have become infected with COVID-19 and recovered. And some of them are now wondering whether they might be immune.
Hi, I'm Lori from Calgary. My question is, if someone has had COVID and they've recovered, do they still need to get vaccinated?
Right now, we know that people who are exposed to the virus do develop some type of immunity. How long it lasts, how good it is, and how effective it is at preventing reinfection if you run into this virus again is not quite clear. And so the take-home message and best advice right now is that even if you've had COVID-19 before, please get your vaccine. It's not dangerous to do so. It's most probably very helpful to do so.
Hi, my name's Tammy and I live in St. Albert, Alberta. My question today is about hand washing. In this new phase of the pandemic, we don't hear anything about hand washing anymore.
I think as time went on and we learned more, it became more apparent that getting COVID from surfaces where it's not impossible to do so, it's not something that's as important. And this is why I'm seeing that when people talk about being very cautious about trying to avoid COVID-19. I note that this often means they're wearing gloves or they're washing their hands a lot, but then at the same time they're in close proximity with other people for prolonged periods of time. I think the big risk to know is that COVID is spread primarily in indoor settings when you're in a enclosed space, especially with poor ventilation and for a prolonged period of time. You're not really going to get it by touching a shopping cart, going to get groceries.
I don't know. I kind of tell people still wash your hands a little more than you used to because people did not wash their hands.
True. Right, but that actually raises an interesting point as an example of how public health advice has changed during the course of the pandemic.
You're flipping and flopping. First you said, I mean, the mask is a wonderful example of this, right? It's completely acceptable to modify your opinion based on new information, emerging information, consensus. Like, you can do this and pointing people at you said this and now you said that. Look, they can't even make up their minds. Like, I don't know about that. That's how science works. Like, you modify your opinion based on fact and based on emerging data.
Right. And looking back, what do you think has surprised you the most?
If you asked me in April that there would be a vaccine available in December, I would not have believed you, and there is. And this has kind of shown this bright spot of human ingenuity. There is a lot of hope in 2021. Things are going to start to get progressively better. And I think one thing that I've learned the most, apart from how important family and friends are, is just how important, and Dr. Barrett mentioned this, is community.
is I think that after I'm out of this, I'm going to want to hug everybody, first of all, but even just being with community, just even walking down the street and having people around you saying hi, it's something that I'm going to be doing a lot more. I think that once this is done, and now for the first time since the pandemic started, I can actually see that being a reality again.
Well, that's really great to hear. And when you were talking about looking forward to hugging people again, I think Dr. Bogosh is hoping to be first in line.
I'm going to hug you so hard, man. So hard.
It's not going to happen because it's not going to be a hug. I'll sit and have some chicken wings with you, but that's where we stop.
Okay, love you guys. I got to go. Bye.
Yeah. Thanks, everybody.
Bye.
After yet another round of COVID-19 questions, it's back to yet another day on the front lines of the pandemic. Jeff Semple, Global News, Mississauga, Ontario.